Hello everyone and welcome again this year on this special day, the 5th of May. Thanks for your energy and commitment to ensuring hand hygiene improvement and infection prevention in healthcare. Every 5th of May, WHO calls for a renewed focus on hand hygiene improvement and sustainability. Healthcare facilities around the world are asked to sign up to the WHO 5th of May Save Lives, Clean Your Hands campaign and to respond to this year's calls to action. In 2017, WHO is urging you to focus on the fight against antibiotic resistance by improving hand hygiene and infection prevention and control practices. Hand hygiene is at the core of effective IPC to fight antibiotic resistance as the most effective measure to stop the spread of resistant microorganisms. Campaigning each year on and around the 5th of May is one important part of improving behaviors and practices.
WHO has recently released evidence-based recommendations on what are the core components that make IPC programs successful in preventing harm. Hand hygiene is key within these recommendations. In this year's call to action, we want IPC leaders, including you, Didier, as well as all of you, to champion hand hygiene campaigning while implementing the WHO core components for infection prevention and control in every healthcare facility. Therefore, to support your activities, promoting hand hygiene and the WHO's core components for infection prevention and control, we have developed a wide range of new advocacy and technical tools, such as a video to explain the IPC core components recommendations, an advocacy document for policymakers, an animation video on IPC, a summary document on the evidence of hand hygiene as the building block for infection prevention and control, and several other tools related to hand hygiene that you can find on the 5th of May webpage.
And I think that everyone can play his or her role to fight antibiotic resistance. Healthcare workers, by cleaning your hands at the right times. Chief executive officers and managers of health facilities support hand hygiene campaigning and lead a year-round IPC program to protect patients from antibiotic-resistant infections. Policymakers, stop antibiotic resistance spread by making infection prevention and hand hygiene a national policy priority.
Therefore, WHO is encouraging all of you, healthcare workers, infection prevention and control leaders, senior managers, as well as policymakers, to demonstrate your commitment.
Let's fight antibiotic resistance together. It's in your hands. Look at this board. Get a board and a pencil. Write your name. Ask your colleagues to do the same and make a selfie or a photo of yourself and all of those committed to fight antibiotic resistance. Then send your photos and selfies to the www.cleanhandsavelives.org and have a look at the large number of your friends and colleagues from around the world who are pledging for better care. Let's fight antibiotic resistance. Let's do it together. It's in our hands.
We wish you a great success and an excellent 5th of May 2017. And thanks for joining us in this annual campaign once again to protect patients and health workers.
Thank you.